Good morning, everybody. Today we're going to briefly talk about toilet training. We want to preface at the beginning, though, if you're not a Westwood-Mansfield Pediatric patient, your recommendations and advice by your pediatrician may be different from ours, and you want to check with your pediatrician first. Today we're going to just talk about a few general rules about toilet training. Several factors and patterns that we see in patients and families and how they develop reward systems can be improved upon in several different ways. Number one, if you're going to use an incentive system for your child around between 2.5 and 3, you want to make sure that you use something like a small poster sheet with the stickers for varying size stickers and varying size colors that will be able to be glued in the bathroom wall or taped to the bathroom wall at the level of the child. Number two, when a child goes to the bathroom, be it on a toilet or be it on a potty seat, they need to have their feet be able to be planted firmly on firm ground. Put your legs up and see if you can go to the bathroom. So always remember that as well. The other rule of thumb is if you meet resistance, break it down into smaller steps. An example, your child feels like they got to go to the bathroom, so you rush them into the toilet and they scream and they yell and they don't want you to put them on the toilet. The best thing to do, first of all, with kids like this, for example, is when they need to pee or poop, is just bring them into the bathroom and let them poop in their diaper. And give them a sticker for that. That's a reward. That's the first step. Then there are many steps beyond that. Remember, going from the base to Mount Everest at camp to the top of Mount Everest isn't something you can do in 2 seconds. So to just reward a child for peeing or pooping is not the initial goal. It should be proceeding to that as the final goal, but not as the initial goal. So a second aspect to this is, for example, you sit a child 2 or 3 times on a day on a toilet because you don't want them necessarily to feel performance anxiety by having to poop when they get right on the toilet. Get them used to sitting on the toilet. There's a great DVD, Elmo's Potty Time, they could watch. You could sit and read a book with them. Keep them on for about roughly 3 minutes and then reward them with a nice sticker for sitting on the toilet. Now, some kids, for example, after a few weeks, you can start making and saying to them, we're going to give you a better sticker if you pee or poop. But you will always give the child a sticker, so there's always positive reinforcement if they sit on the toilet and you have a specific type of sticker for sitting on the toilet. Now, some kids you can meet resistances. They still don't want their diaper off, but they'll sit on a toilet and poop in their diaper. We all want our kids to get out of diapers. It is an inconvenience. But it may take them a little bit longer, so as a result of that, you may have to allow them to poop in their diaper on the toilet. And then at some point, give a better sticker for them saying, when you take it off, we can use this sticker as well. Make this a fun process. You don't have to base your self-esteem on your child being toilet trained by 2.25 years. Sometimes for grandparents, that was the case back then. That's how motherhood was defined. It's no longer really defined that way anymore. We hope that this helps you, and we hope that these little tidbits in toilet training will make it a more pleasant experience. One final comment, if your child becomes constipated before you start the process or during the process, you need to clear out the constipation beforehand, and we can talk to you about that in another video.